Understanding pain. Welcome to the LPN Launchpad. Today, we are diving into a fundamental aspect of nursing care understanding pain. As a nurse, your ability to assess and advocate for a patient in pain is one of the most vital skills you will develop. In this module, we will explore the nature of pain, how the body processes it, and the theories that guide our nursing interventions. The nature of pain. What exactly is pain? Margot McCaffery, a pioneer in the field, defined it best. Pain is whatever the experiencing person says it is, existing whenever he says it does. Because pain is a complex, subjective experience, only the patient can truly describe it. It serves as a cardinal sign of inflammation and a vital warning signal to the body, but remember that pain can also occur without visible tissue damage, as in the case of emotional grief. Pain perception. It is a common misconception that pain is felt at the site of injury. In reality, pain is recognized in the brain. The process begins with nociceptors, specialized receptors located throughout the body. These receptors detect harmful stimuli like extreme heat, physical pressure, or chemical changes and convert them into electrical signals. These signals are the language the nervous system uses to communicate damage. 7 steps of pain transmission. The journey from injury to awareness happens in 7 specific steps. First, the injury occurs. Second, transduction occurs when nociceptors generate an electrical impulse. Third, the signal is transmitted to the dorsal horn of the spinal cord. Fourth, it ascends the spinal cord via the spinothalamic tract. Fifth, the thalamus acts as a relay station, processing the signal. Sixth, the person reaches conscious awareness when they realize it hurts. Finally, modulation occurs, in which the brain sends signals back down to release natural pain relievers. Gate control theory. The gate control theory is essential for understanding how we treat pain without medication. Think of a gate in the dorsal horn of the spinal cord. Pain signals travel on small nerve fibers and open the gate. However, non-painful stimuli, such as massage, heat, or pressure, travel along large nerve fibers. These large fibers can close the gate, effectively blocking the pain signals before they ever reach the brain. Endorphins. Our bodies have a built-in pharmacy. Endorphins are natural, morphine-like substances that bind to opioid receptors in the brain to block pain. As nurses, we can trigger the release of these chemicals through non-pharmacological techniques such as TENS units, acupuncture, relaxation exercises, and even laughter. Acute versus chronic pain. We classify pain primarily by its duration. Acute pain is intense and short-term, lasting less than 6 months. It acts as a warning sign and triggers a fight-or-flight response, often causing an increased heart rate and blood pressure. Chronic pain, however, lasts longer than 6 months. It no longer serves as a warning and is frequently linked to secondary issues like depression, low self-esteem, and sleep disturbances. Types of pain by source. Finally, we classify pain by its source. Nociceptive pain is aching or throbbing from physical tissue damage. Neuropathic pain is burning or shooting, caused by damage to the nerves themselves. We also see visceral pain, which arises from internal organs. Visceral pain is often difficult to localize and may be felt as referred pain in a completely different part of the body. NCLEX, question 1. Let's check your understanding. A patient who underwent a total knee replacement 4 hours ago reports a pain level of 8 on a scale of 0 to 10. The nurse notes the patient is grimacing and has a heart rate of 115 beats per minute. Which type of pain is this patient experiencing? 1. Chronic pain. 2. Neuropathic pain. 3. Acute pain. 4. Visceral pain. Answer and rationale. The correct answer is 3. Acute pain. This is the correct choice because the pain is a result of recent surgery and is accompanied by an increased heart rate, which is a classic fight or flight response seen in acute episodes. Chronic pain would require a duration of over 6 months, and visceral or neuropathic classifications do not match the musculoskeletal nature of a knee replacement. NCLEX. Question 2. The nurse is caring for a patient with back pain and suggests using a TENS unit and massage. These interventions are based on which theory of pain? 1. Endorphin release theory. 2. Gate control theory. 3. Nociceptive transmission theory. 4. Synergistic perception theory. Answer and rationale. The correct answer is 2. Gate control theory. This theory suggests that by stimulating large nerve fibers through touch or electricity, we can close the gate in the spinal cord. This prevents pain signals from reaching the brain, providing non-pharmacological relief to the patient. NCLEX. Question 3. Which statement by the nurse best reflects the definition of pain as described by Margot McCaffery? 1. I will wait for the heart rate to rise before giving meds. 2. Pain is whatever the patient says it is, occurring when they say it does. 3. Pain is only real if there is an actual injury. 4. The nurse determines if the patient's pain level is accurate. Answer and rationale. The correct answer is 2. Pain is whatever the patient says it is, occurring when they say it does. This statement is the foundation of patient centered pain management. Because pain is a purely subjective experience, the patient, not the nurse or the monitor, is the only reliable authority on its presence and intensity.